Remember that time when everyone went crazy for kale smoothies? It seemed like everywhere you looked, people were blending up those leafy greens. Yeah, well, move over green juice, because there's a new health craze in town: intermittent fasting. It's the latest trend that's taking the health world by storm. Suddenly everyone from your Wall Street buddy to your yoga instructor is raving about skipping meals. It's not just a fad, it's becoming a lifestyle choice for many. But before you ditch your morning bagel, let's break down what intermittent fasting is all about and why it's causing such a stir, especially when it comes to men's health, prostate health, to be precise. This isn't just another diet, it's a whole new approach to eating. Fasting, as it turns out, isn't just about fitting into your skinny jeans, though that's a nice bonus. It's about more than just weight loss. It's about giving your body a break from the constant barrage of food and allowing it to tap into its inner healing power. This period of rest can have profound effects on your overall well-being. And for guys, especially those worried about their prostate, this ancient practice might just hold the key to a healthier, happier future. It's not just about living longer, but living better. Intermittent fasting isn't about what you eat, but when you eat. It's a unique approach that focuses on the timing of your meals rather than the content. It's all about cycling between periods of eating and voluntary fasting on a regular schedule. This cycle can help regulate your body's natural rhythms and improve overall health. It's not a diet in the traditional sense. It's more like an eating pattern. You don't have to count calories or restrict certain foods, making it a flexible option for many. Think of it as giving your digestive system a well-deserved time out. This break can help your body focus on other important functions like repair and detoxification. There are a bunch of different ways to do it, so you can find what works best for your lifestyle. Some popular methods include the 16-8 method. The most popular method, also known as the LeBron James diet, yes, even King James is doing it, involves fasting for 16 hours a day and squeezing your meals into an 8-hour window. This method is great for those who prefer a daily routine. The 5-2 method. Eat normally for 5 days a week and restrict calories to 500 to 600 for 2 non-consecutive days. This method allows for more flexibility during the week. Eat, stop, eat. A full 24-hour fast once or twice a week. This method can be more challenging but offers significant benefits for those who can manage it. No matter which method you choose, the basic principle remains the same. Give your body a break from digesting and allow it to switch into repair and rejuvenation mode. This can lead to improved energy levels, better mental clarity, and overall well-being. Sure, shedding a few pounds is a common side effect of intermittent fasting, but the benefits go way beyond fitting into your slim-fit shirts. Fasting has been linked to a laundry list of health benefits, including sharper thinking. Ever feel like your brain is running on fumes after lunch? That's brain fog for you. Intermittent fasting can sharpen your focus and boost your brain power. Taming inflammation. Chronic inflammation is like the villain in a superhero movie, always lurking in the background, causing trouble. Fasting can help reduce inflammation throughout your body, from your joints to your arteries. Lowering your risk of chronic diseases. Studies have linked intermittent fasting to a reduced risk of heart disease, type 2 diabetes, and even some types of cancer. Now let's talk about the main event, prostate health. The prostate, a small gland located below the bladder, can be a source of anxiety for many men as they age. Benign prostatic hyperplasia, or an enlarged prostate, is common, leading to uncomfortable urinary symptoms. And then there's prostate cancer, a serious concern for many men. Here's where intermittent fasting comes in like a knight in shining armor. Emerging research suggests that this ancient practice may play a role in promoting prostate health. Fasting and your prostate, the science behind the hype. While research on intermittent fasting and prostate health is still in its early stages, some studies have shown promising results. Researchers are delving deeper into understanding how fasting impacts prostate health. Here's a sneak peek into what scientists are discovering and why it's generating so much excitement. Reduced risk of BPH. Benign prostatic hyperplasia, or BPH, is a common condition as men age. Some studies indicate that intermittent fasting may help lower the risk of developing BPH, possibly by reducing inflammation and oxidative stress in the prostate. This could be a game changer for many. PSA, or prostate-specific antigen, is a protein produced by the prostate. Monitoring PSA levels is crucial for early detection of potential issues. Elevated PSA levels can be a sign of prostate cancer, which is why keeping them in check is important. Intermittent fasting has been linked to lower PSA levels in some studies, suggesting it might be a beneficial practice for prostate health. Enhanced cancer treatment. Emerging research suggests that intermittent fasting may make some cancer treatments, including those for prostate cancer, more effective. This could potentially improve outcomes and offer new hope for patients. Are you ready to give intermittent fasting a shot? Start here. If you're thinking about giving intermittent fasting a try, it's crucial to talk to your doctor first, especially if you have any underlying health conditions. Once you get the green light, here are a few tips to get you started. 1. Ease in. Don't go from pizza night to a 24-hour fast overnight. Start gradually by extending your overnight fast by an hour or two. 1. Stay hydrated. Drink plenty of water, unsweetened tea, or black coffee during your fasting periods. 2. Break your fast wisely. When it's time to eat, choose healthy whole foods that nourish your body. Remember, always listen to your body, dude. Intermittent fasting isn't a one-size-fits-all approach. Pay attention to how your body responds. If you experience any negative side effects like dizziness, fatigue, or headaches, adjust your fasting schedule or talk to your doctor. Remember, your health journey is unique, and what works for your buddy might not work for you. Listen to your body, be patient, and don't hesitate to seek guidance from your healthcare provider. Section 8. Fasting, a New York state of mind? So, there you have it, the lowdown on intermittent fasting and its potential benefits for prostate health. In a city that never sleeps, where stress levels are higher than the rent, taking a break from food might just be the key to a healthier, happier you. Remember, this is just the tip of the iceberg. There's a whole world of information out there about intermittent fasting. Do your research, talk to your doctor, and see if this ancient practice is the right fit for your modern life. If you found this video helpful, don't forget to subscribe to our channel and give it a thumbs up. And be sure to check out the next video on your screen for more insights into healthy living. Thanks for watching.